Would you say that everyone that has any joint pain could benefit from stem cells?
We would have to see why the joint pain is,
Sure.
definitely, and just give yourself sort of like a slap on the face for them to start regenerating, start regrowing, and do it faster and more efficient.
I really love about them is that, they ask to have first the MRI, and then they really took the time, to study it. And I think this is super professional. And I spoke to a lot of people that without saying nothing, without, just by asking one or two questions, they're like, okay, I can do it. And it seems, and maybe I'm sure 85% are right and will do a good job. But I mean, you just feel more comfortable when you send your actual MRI, which is like your unique knee pain, and then you study it, and then we do a video conference. It's free of charge, and then we make sure that you get a good feeling about it. So and then we can decide if we do it or not. Hi, welcome to today's podcast. Welcome to Costa Rica. So today we had the honor to be at RMI with Dr. Marcelo Gonzalez and the whole team for stem cell therapy and a plant tour. So thank you very much for watching. And we're going to deep dive into the stem cell today. And you're going to go and see like the back tour of it. So Dr. Marcelo, thank you very much for being here today.
Thank you for coming. Thank you for trusting us.
Yeah.
We're very excited.
So I want to acknowledge, I told you when we were walking, but this company so far is world-class, being super impressed about the way they treat us. And I flew yesterday from Canada, from the snow, arrived here pretty late. They have a very nice,
To
the sun, beautiful sun. And I had the chance to do a plant tour, to speak to the whole staff. And I'm super stoked, super excited to get that procedure.
yeah, it's gonna be really good.
Yeah, so today I'm gonna have a meniscus tear stem cell therapy. So can you tell me a little bit more about about knee stem cell therapy?
Okay, so in terms of musculoskeletal research with stem cells, knee is pretty much the one that's been investigated the most. Okay, so arthritis is the one that gets investigated the most, and cartilage defects are have a bunch of research behind them. Okay, what we're gonna be doing is pretty much your tear, the tear that you have. Imagine the meniscus is like a beef patty in between the two bones of the knee. Okay, and the tear has it's a tear through the middle of it. Okay, imagine they're passing a knife through the middle of a patty. Okay, so it's a little bit opened up. Okay, the idea is to, with the ultrasound guidance, put the needle in between in the tear inside of it and put the cells around there. Okay, it's gonna be probably a couple inside the meniscus and a couple inside the knee. Okay, we're gonna be doing some ultrasound images beforehand. With just the MRI images, that's the plan that I have. But with the ultrasound images, I might get a little bit something else that we need to treat. So I would love to, if I see some type of tendinosis, if I see some type of anything else going on, I would love to put the cells in there as well. Okay. So
I'm
yeah.
curious, just to give a little bit backstory. So basically, a year and a half ago, I did a big ski jump. So I'm a ski addict. So and I did a big jump and land on my left knee, and it really hit. And I remember like the movement, like the twisting movement. And so why it's not my ACL or some? I mean, you were not there during the accident, but I mean, from the MRI that you saw, what do you think happened, like to my knee, like to have the meniscus tear, but not like everything else destroyed? So.
All right. So ligaments in general in the knee, they're going to prevent you from the two bones from going sideways and to going forward and backwards. Okay, so the MCL, the LCL, the PCL, the ACL. Okay, those are like the general ones, and they're going to prevent the bones from going to different sides. Okay, the meniscus is the one that's going to be lesioned when there's the meniscus is the one that's going to receive the big impact in case that happens. There could have been some cartilage lesions also, but in this case we don't have it. You got lucky. But in those type of traumas, it's pretty much luck. Okay, so yeah, exactly. So pretty much when you crash, when you have a motorcycle crash or anything else, why does anything blow up? it's pretty much chaos theory. Okay, anything could happen. Some things should happen sometimes, but sometimes just anything happens.
And would you say like stem cell therapy, like the one that we will be doing for my meniscus, could be also good for ACL or like other ligament around the knee?
Okay, yeah. So complete tears, we won't be able to treat them. Okay, stem cells can't grab both ends and put them back together. Okay, but the idea is to in terms of partial tears or just sprains. Okay, the idea is to help the cells of your own body regenerate that. Okay, bring it back to normal, lower the inflammation, which gives your cells a worse environment for them to thrive, and lower that inflammation, and just give your cells sort of like a slap on the face for them to start regenerating, start regrowing, and do it faster and more efficient.
Mm. And we were discussing like there's different type of cell, and the one that we would be injecting in my body will be the MSC cell. Correct. And so are they actually the cell that's gonna repair, or that's gonna, or they're, because I heard like sometimes they're sending a signal. So can you explain me a little bit, because it's not clear to me like what's going on when we inject, like what's going to happen basically.
Okay, great. Okay, so yeah, we're using mesenchymal stem cells. The acronym is MSCs. Okay, so mesenchymal stem cells are they are gonna have three different functions. Okay, first of all, they have a bunch of anti-inflammatory factors that are gonna be releasing. Okay, so only that is gonna lower the symptoms, is gonna lower the pain, and is gonna make a favorable environment for the cells to thrive. All right. Second of all, they are going to talk with your own cells. They sort of attach to your own cells and start talking. Okay, that's how they sort of give them like a slap on the face for them to start thriving again, for them to start replicating and do new things. Okay, that's the mechanism that we rely on to do some type of regeneration, or to do some regeneration faster than it should be. Okay. And lastly, there are some very tiny amount that actually differentiate into the tissues they're around with. So if I put them directly into cartilage, some of them are going to differentiate. It's just a very tiny amount, and that's not the mechanisms that we're looking for to regeneration and to lowering the symptoms. And that's what mostly people think about stem cells. It just cells that go in there and turn into cartilage.
Yeah.
But that's not what we're using it for. So some of them actually do that, but that's not what it is. Yeah, that's more a small percentage to it. So we are relying on your own body to sort of we're just giving a boost to your own body, to your own cells.
So water's not doing it right now. I mean, like, why do they need a boost to kind of wake up and rejuvenate? Yeah.
Okay, so inflammatory states make them inefficient. Okay, so only lowering that inflammatory state will make them more efficient. Okay, and just signaling in general. Okay, so these signals sort of it's like an alarm clock. Okay, your body, you are gonna be sleeping until 8 a.m. If there's nothing else that's gonna tell you, hey, wake up sooner. Okay, so especially cartilage has a very hard time regenerating by itself, and it doesn't have arteries or veins that go directly to it, so they get their nutrients by other things. Okay, by diffusion from other things, meniscus in general get it from the liquid inside the joint. Okay, so if the liquid inside the joint is also inflamed, if the things that produce that liquid is also inflamed, we are gonna get less nutrients. It's gonna be in general just an environment that is not gonna let your cells do what they have to do. Okay, in general. I don't know if that answers the question. Yeah.
Okay, that's amazing. And so, what would you say that everyone that has any, joint pain could benefit from stem cells?
Okay, we would have to see why the joint pain is. Sure. Definitely not.
To go to the source, right?
Exactly. I'm not gonna say all of joint pain, but
Yes.
most of the joint pains are due to some type of inflammation or chronic inflammation that hasn't been resolved, or your body hasn't been able to resolve it. So that's where the cells come in. Okay. For example, tendons when they get inflamed, and it's very common, they have a really hard time lowering that inflammation. Okay, just because we're constantly using them, they have a bad blood flow, and they're in constant trauma. Okay, so they have a really hard time just lowering that inflammation and going back to normal. The idea of the mesenchymal stem cells is to sort of give them like a slap on the face. Okay, like, hey, good dude, come on, bring it down. Okay, so to boost it up. That's the idea.
And that's one of the things I really love about them is that, they ask to have first the MRI, and then they really took the time, to study it. And I think this is super professional. And I spoke to a lot of people that without saying nothing, without, just by asking one or two questions, they're like, okay, I can do it. And it seems, and maybe I'm sure 85% are right and will do a good job. But I mean, you just feel more comfortable when, like, you send your actual MRI, which is like your unique knee pain, and then you study it, and then we do a video conference. It's free of charge, and then we make sure that you get a good feeling about it. So and then we can decide if we do it or not.
Exactly. Yeah,
I thought that was really reassuring and really professional. So
yeah. Well, thank you for saying it.
Yeah. I'm saying it for everyone because I mean, sometimes I mean, I talk with a lot of different friends and people, and they're kind of unsafe, and feel insecure. But I feel like when you have that approach, it's super professional and make us very secure to feel we're at the right place. So
no, thank you. Yeah, that's why we do it. Yeah, you're paying a lot of money and you're coming to a foreign place, so we do want you to come here for something that's gonna help you. Yeah, we sometimes turn away patients. We just tell them,
really,
yeah, we know.
Are you sure?
I assure you, yeah.
So what's
Is that we'd rather just is that we do a follow-up with our patients.
Sure.
So if the patient is constantly saying, hey, this is not working, what the hell, and doing some trouble about that, it's very, and we don't like that. So we'd rather just turn away patients than for example, some vertebral, some back pains, there are nothing that we can do about it. If your knee is too far along, if your knee has a big arthritis that is too far along, we'd rather just tell you the truth. We're just gonna delay you doing a replacement. Okay, so just go ahead and get the replacement already, and things like that. Me and Felipe, the ones that we do this treatment, the musculoskeletal treatment, we have a background in orthopedics, so we do know the benefits that a surgery can give you. Okay, we know we don't
agree about surgery.
Yes, of course. Yeah, surgery is a big weapon to resolve a bunch of things, a bunch of things.
Sorry, people that get the knee surgery, and actually, there's one of my friend that just had it a couple months ago, and he's still in pain, and like he feels he's worse than before.
Exactly,
he's looking like he's very curious and about this stem cell therapy that I'm gonna do, so it can maybe help him recover from his surgery.
Exactly.
So,
well, yeah. So surgeries are a great weapon. Okay, they can resolve a bunch of problems, like millions of problems. Okay, but right now in this day of age, we only have for a bunch of pathologies, we only have surgery as a solution. For us, the idea is to get into those spaces, and instead of you getting surgery for pretty much any knee pain, we have a solution for that. Okay, and we can prevent you either prevent you from getting a surgery or just kicking the can down the line as much as we can. Okay, for example, in terms of arthritis, if you're a little too far along or if you're too young with arthritis, you are gonna probably need a replacement down the line. But our idea is to make it as late as possible. Okay, usually replacements do, if the best replacement that you can get, it will last you around 15 to 20 years. Okay, if you take care of it as well. Okay, so if you're 50, if you're 60, probably at 80 or 70, you're gonna have to have another replacement, and that replacement is not just changing the parts and doing and going along with your life. That replacement usually entitles a bunch more cutting, a bigger replacement, and a bigger surgery. Okay, and each time you do that, it's going to be a bigger surgery, and it's going to be harder to come back to whatever you want. So If we can turn those 3 surgeries into 1 or 3 into 2 at least, for us is a big success.